Welcome, everybody. I hope all of you are staying safe and healthy. Um, we are very fortunate to have professionals such as Dr. Jolly on our staff that can provide some guidance and insight on these ever-changing guidelines that have been put out by both CDC as well as our local jurisdictions in terms of mask wearing and social distancing and how we should be adapting to, I guess, resuming life under what I call the new normal. So, I'm sure many of you have questions that our team of professionals will be happy to address towards the end of the presentation. In addition to that, they'll cover kind of the current state of COVID-19, not only in the US, but frankly around the globe. And also, as part of our presentation, we're going to have Aaron Staley address what is our policy, i.e. Aveshka's policy in terms of returning to work. What does that look like and how is that compared to what it was prior to the pandemic? So with that, let me turn it over to Dr. Jolly and Carissa. I too am looking forward to this discussion. Thank you.
So, thanks everybody for joining, and thanks, Girish, for having us. As Girish said, we're going to talk about what is currently a pretty still fast-changing situation, daily news, and questions. And so there have been questions all along, and we're going to address some of those questions today for many of you, and really talk about the situation. There are lots of things moving and news, and we want to make sure you get the latest updates. So without any further ado, I'm going to turn it over first to Dr. Deidre Parrish, who's going to talk a bit about vaccine and, importantly, some of the age-based recommendations that have come along recently. So, Dr. Parrish.
Thank you so much, Till, and thank you everyone for having us. So I'm just going to briefly give a little bit of vaccine update. A lot of it you probably have heard in the news. So the Pfizer vaccine has now been authorized for ages 12 to 15, and that was authorized just last week, and the ACIP promulgated their recommendations related to that. Already, a lot of 12 to 15-year-olds are being vaccinated and have been vaccinated, so that's great news. With this vaccination age group, the dose of the Pfizer vaccine is the same, and it's the same schedule, 2 doses, 3 weeks apart. One specific change that was made by the ACIP in regard to COVID vaccinations was that before, when the COVID vaccines were first being introduced, they had the recommendation to not give other vaccines along with or within 14 days of a COVID-19 vaccine. So that recommendation has been removed, and now they recommend giving any and all vaccines along with a COVID-19 vaccine without regard to timing. What that does is it makes it easier, especially for kids and back to school, to get caught up on all of their regular vaccines as well as to get vaccinated for COVID. And that'll be a big benefit as more people in this age group get vaccinated. So the implications for opening up this group, is large. I mean, this will increase our total percentage vaccinated, since we now have a whole group that is eligible, a whole new group that is eligible for vaccines, to push us further, toward getting more of the population fully vaccinated. This advancement will also inform upcoming CDC school guidance. The current school guidance is unchanged, and the CDC still recommends all of the mitigation measures that they have for the remaining parts of this school year. The CDC is planning to review data, especially as younger people get vaccinated and come up with more school guidance for the next school year. In terms of looking at age ranges below 12, both Pfizer and Moderna are currently in studies looking at kids from ages 6 months to 11 years. So Pfizer started those trials in March and Moderna shortly after in April. And it is expected that there will be some EUA submitted for vaccinating in younger age groups by either the end of this year or early 2022. So it will be a little while before younger age groups get a chance to be vaccinated, and the vaccine companies are looking at obviously different doses for these smaller, younger kids. And with that, that's all I have in terms of vaccine updates, and I'll turn it over to Greg Lord to talk about additional new CDC guidance and the non-pharmacologic interventions. Greg?
Yeah, good afternoon or morning, depending on where you are. Pharmacological interventions generally are the mitigation strategies that we've been hearing the most about. These are things that we can do both individually and in our environment that improve our ability to avoid the virus. Most commonly is the mask issue. Yeah, so when we talk about masks, as everybody knows now, last Thursday, you can probably jump down to the mask one. I'll come back to physical distancing. So as you all fully are aware, last Thursday, Dr. Walensky at the CDC announced that fully vaccinated people could behave differently, and certainly much more akin to the in the individual circumstance. And that's an important point I want you to remember, that individually people can behave better or differently and return more towards normalcy, I guess, when they're fully vaccinated. The need to wear a mask, certainly in outdoor settings, is no longer required if you're fully vaccinated, except, and this is the caveat across all of these things, is if you're local or state or federal guidelines still required to do any of these mitigation strategies, you should. But certainly wearing a mask if you're fully vaccinated doesn't need to be accomplished or worn nearly as often as it used to be. And here again, there's a certain amount of recognition that fully vaccinated people have obtained a level of protection that allows them to be pretty safe. If you're currently unvaccinated or only partially vaccinated, then you need to continue with the previous mitigation strategies. Certainly mask wearing when you're out in the public, certainly when you're in indoor settings outside of your home, and certainly when you're outdoors in large groups. And this is really based around the idea that you just don't know the vaccinated status of the people you're around. And that creates risk to you, and obviously by extension, your family. If you don't mind, let's go back to the first slide. And we'll talk globally quickly about the other mitigation strategies. There you go. So, the idea that we can do certain things really revolve around mask wearing, socially distance, physical distancing, avoiding crowds and close proximity, especially when you're indoors, and washing your hands. And this is the strategies that we've undertaken in not only our guidance to all our clients, but certainly with our guidance to our colleagues and friends and family, because what we've learned over the last 14 months is that this is certainly the way to provide the safest environment to you and your family, is maintaining physical distance, washing your hands frequently, wearing a mask when appropriate, and avoiding large crowds in the indoor environment. This is now different. Next slide, please. There you go. if you're fully vaccinated, the CDC advised last week that physical distancing, whether you're indoors or outdoors, is less of an issue because of your protection. But you'll note that if you're partially or unvaccinated, you need to continue to do that. If you don't mind, skip ahead a couple slides. One more. There you go. So hand hygiene, always worth reminding everybody that good hand hygiene is not just about preventing COVID. This is about preventing a slew of other viruses and bacteria. I don't know how many of you have noticed, but our flu numbers for this year are incredibly low, as well as most of the communicable diseases that we've seen. And this is due in part to the fact that people are paying attention to good hand hygiene. Certainly mask wearing has had a play in it as well, and physical distancing. But hand hygiene really does make a difference, not just during COVID, but literally every day to the prevention of communicable disease. How you wash your hands does matter. You probably heard back and remember back during the beginning of the pandemic when the hand washing was really being pushed forward that, you know, you should develop a methodology that allows you to wash your hands with soap and water for at least 20 seconds and then dry them and throw away the towel. So just a reminder that this is good advice regardless of whether we're in the middle of a pandemic or not. And I'll stop here. Certainly we'll be available for any questions as we get further into it. Yeah, let's go ahead and remind everybody that this has changed as of last Thursday, and actually was already in change over the last month or so. But traveling now is different if you're fully vaccinated. You can do so relatively safely because you are fully vaccinated. You are still required to wear masks when you are on public transit, and that plane, trains, and buses, as well as certainly if you're in a area that has a public transit system when you're on those. It's still a requirement, and you should still wear a mask, not just because it's a requirement, because it frankly is the best way to prevent you from catching the illness in any way, shape, or form. If you're an international traveler, this has changed some of the requirements around testing when you're returning to the U.S. And those sorts of requirements. It is still advisable that you get tested before you depart your origination to return to the States. And then after you return, they still want you to get a test 3 to 5 days post, just to ensure you didn't get anything on the way. But for vaccinated people, the risk is so much lower that they are saying that it's safe for you to travel now. If you're unvaccinated, nothing has changed a lot here, besides the fact that everybody still has to wear a mask when they're in transit or traveling. Social or physical distancing is incredibly important. Hand washing, incredibly important while you're traveling. And recognizing the environments in which you will be at risk, whether you're on a plane, a bus, or a train. Those are closed spaces. And although many of them have upgraded their air filtration systems to improve the air itself, you're still in close proximity. And if you are to somebody that is ill and carrying the virus, you can be put at risk. So if you're unvaccinated or partially vaccinated, these mitigation strategies of physical distancing, hand washing, and wearing a mask are incredibly important to you if you're going to have to travel. But fundamentally, you probably shouldn't travel according to the guidance if you're unvaccinated. Dr. Jolly?
Okay, thanks for that, Greg. So as you see, there's a lot of information that is changing very quickly. And thanks to Dr. Parrish and Greg for those presentations. What I want to do now is just touch on a couple of issues and lead into the next discussion. And I think there are already some questions, and there are probably going to be more. For perspective, I'm not going to show a lot of graphs and charts, but realize that things are clearly getting much better in the United States. But our international partners around the world are still struggling in many ways. I'm just going to point out a few specific instances and not sort of give the overall numbers, but realize that COVID is still with us. And, you know, this, as we all know from our infectious disease expertise and emergency preparedness expertise, we're a very interconnected world. So the one that we've heard the most about most recently is India. India really, really struggling. I mean, cases Their 7-day average is over 300,000 cases a day, and they've had as many as 4,000 deaths a day. We think those numbers are actually low. You see very dramatic footage of funeral pyres, of burning of bodies in sort of a mass way, um, and stories that are really true and heartbreaking of patients who die for lack of oxygen because the hospitals don't have oxygen, and that's a fairly basic need. Now, we actually saw a little bit of this here, where hospitals ran out of oxygen and patients had to be transported, but for no oxygen to be available in a locality and people to die for that reason is truly tragic. And India is one of our major partners in many ways, and is actually a source um, for a lot of the raw materials for our pharmaceuticals. So really a major player in this. Nepal, a close neighbor of India, is now testing 44% of their tests positive from data I saw yesterday. Nepal has a very limited healthcare capacity, and is very dependent on tourism and other things. So clearly a small a country struggling. Argentina in South America, also struggling, high number of infections daily per 100,000 people, about 380, with only 11% of the country vaccinated. And that's part of the story. We have, we don't have what we want for vaccination, but many countries are struggling without vaccination. And then Japan, very interesting story. We know the Summer Olympics, postponed from last year, are supposed to come up this year in Japan. They're having a significant infection problem, and only 1 to 2% of their population are now vaccinated. In fact, the population is on surveys doesn't want the Olympics there, and part of the contracting for the Olympics is the sort of the guaranteed hospital capacity for Olympic participants, which is tough at a time when the hospitals are somewhat overwhelmed with cases. And then, our partners in the UK are now seeing something that we have to really worry about, which is the variant, which is known as B.1.617.2, or B.16172, which is the variant that is rocketing through India, is now highly present in the UK and is thought to be between 30 and 50% more infectious than the variant that was more infectious in the UK to start with. And it actually is in this country. There are now cases documented in this country of this variant. We worry about this one. We believe it's susceptible to vaccines, but we don't know exactly how susceptible at this point. So this is a word of caution among a lot of optimism for us. So kind of this comes to the question of what's next, and I put this on the agenda, but I don't really have a crystal ball to say what's going to happen next. Everybody kind of wants to project what's going to happen next, and I've said in prior town halls, both with you, the Aveshka employee group, and with other of our partners, that if anybody's telling you exactly what's going to happen in the next month or two, don't really listen to them because they're probably wrong. But there's no doubt about what's going on now. We're all very tired, and I do want to emphasize, we haven't said it yet in this call, but I'll say it. You'll probably hear it again. You're tired. Your kids are tired. Your families are tired, and if you feel like you need help, and we are concerned about the mental health aspects of this, seek help, either through programs that Aveshka has for employee support, or other support you have. If you're not alone and it's something that you really need to keep in mind. But we are seeing hopeful signs. In some cases, a little too hopeful, because some people are sort of pretending that the pandemic is over, which it's clearly not. We're still having cases, we're still having deaths, and we're still having stresses on the system. But lots of jurisdictions are starting to open up. You see that locally in the Washington, D.C. area, with the city, with D.C. and counties in Maryland and counties in Virginia, changing their guidelines. And they're frankly hard to keep up with. And Greg did a very good job of reviewing what some of the guidelines are, but there's a lot of what ifs in those, and they're very dependent on local guidance. There was an article in the Post this morning about even how confusing it is to watch people from the White House as they go from jurisdiction to jurisdiction trying to follow the local jurisdiction rules. A few challenges left. The vaccine uptake is still not where we want it. We're still under 40%, I believe, in the latest numbers for total population, and still some challenges in getting folks vaccinated. And if you can take a lot from what Greg's slides were and what Dr. Parrish said, but it's remarkable. There are two lists of important factors. are you vaccinated or are you not vaccinated? And that governs how safe you can feel. And that's something that we need to, a message we need to spread to everybody that we come in contact with. Many of us have children either in schools or colleges, and that's going to be an important part of getting back to whatever normal is. And we're seeing guidance from schools and colleges about what's going to happen in the fall. As we plan forward, that's going to be big for us. Also, we need to remember that the winter is coming, and respiratory viruses like the winter. They unfortunately COVID liked the summer last summer also, but they really like the winter. And we had almost no flu season last year. Flu shots are going to be important, and a mix of flu and COVID in a patient population is going to be very difficult to deal with. So we're going to have to be at this for a while. We can certainly enjoy the successes we've had. If you're vaccinated, take advantage of that. But don't be cavalier about it. And then, we do need to remember that with internally for us and with our clients, we always need to keep in mind what happens if we need to make a strategic retreat. And a strategic retreat means something has gotten worse, maybe not nationally, but in a local area. How do we manage that data? How do we manage our workplace? How do we manage our family? And think of it as not that we've lost a battle, but we just are making smart choices in what will continue to be an ever-changing environment. So, probably more questions than answers. And I think that's all that anybody can do, but I think we want to share as much guidance as possible. Yeah, go ahead. And so what we'll do, as we've done before, lots of questions in the chat. We'll try to get to all of them. And Carissa, if you could just manage this from a flow standpoint, that would be great.
Sure. Our first question, what is expected timing for EUA for children 11 and under?
I'll turn that to Dr. Parrish if you're still there. I think she addressed that a little bit, but maybe just reiterate.
Yes, absolutely. So it may be before the end of this year or early 2022 when at least Pfizer and potentially Moderna may have an indication for children less than 12. And this might roll in more kind of age band phases because, as I mentioned, for the younger kids, they're testing different doses of the vaccine as opposed to the full dose that 12 and up are getting.
Okay, and the next question is, what is the timing for full FDA authorization of adult vaccines?
Hey, Dr. Parrish, you may have a thought on that.
Yeah, so as far from what we can estimate now, it potentially by the end of the year of this year, 2021, Pfizer may have full approval of its COVID-19 vaccine as opposed to emergency use authorization. Obviously, the FDA has a lot of different processes and they have their own kind of protocols and things to go through, and it's obviously a lot of data to go through. But as the latest reports is that it's anticipated by the end of the year. Obviously, that may change if something comes up, but we already have a whole lot of data just from the volume of vaccines that have been given. So potentially by the end of the year.
And that's one thing I'll add. That's a very important question because some institutions are tying requirement of vaccine. I saw one yesterday actually tying requirement of vaccine to full approval versus authorization. So obviously, if the FDA figures out a way to do this faster, they will, and they do clearly have data into the now 100 million combined among the vaccines. So hopefully soon. Carissa?
Okay. Can't fully vaccinated people still infect unvaccinated individuals?
I'll start that. Dr. Parrish, you may want to add in on this. It is theoretically possible. What we do know now is that, yes, vaccinated people can be infected. We've seen this actually, just if you read the sports pages, you see it from the New York Yankees. But we also have data that their viral load is significantly lower than infected unvaccinated people. So while theoretically they could pass it, they're less likely to. Dr. Parrish, you may want to add in.
Yeah, I would just completely agree with what you said. I think there was a concern early on that that would be the case. And as we have more experience with more people being vaccinated and looking at the data, that really hasn't been borne out in practice. And for those reasons that Dr. Jolly described, if there is infection, there's low levels of virus to the extent that passing it on is less likely. So that's not as much of a concern, and I think that, along with all of the other benefits of the vaccine, have informed these recent changes in the recommendations for vaccinated folks.
Thank you, Carissa.
Okay. What would you have to show proof of, or would you have to show proof of vaccine before flying or traveling?
Greg, do you have any information on that specific? I know airlines may and countries may manage this differently. Greg, any thoughts on that?
So I am unaware of any country, and obviously the U.S. is the most concerning to us, that has required anybody to provide proof of vaccination in order to fly. There are some entities out there who are discussing it, notably some of the trans-Pacific airline carriers are currently in the process of figuring out how to implement that sort of policy, but it has not been implemented in the United States. Basically, this comes down to an honor system. People who believe they can fly safely can do so, and they don't have to provide any proof of vaccination. There are still communities and states that require you to be tested upon arrival, Hawaii being notable. They still have a testing requirement, at least as of a couple of days ago. And so they are addressing the safety of their community through a testing process as opposed to validation of a vaccine. So I think, at least in the near term, these sorts of issues of validation of vaccine coverage is really going to come down to an honor system. I'm not seeing anything that is going to get outside of that very quickly or easily.
Thanks, Greg. Carissa?
When do they forecast all of these safeguards for everyone going to end? Is it this year, next year sometime, time frame?
That's an interesting prediction question, so I try not to make too many predictions. I don't have a great answer for that. It's fascinating. I had a discussion. I still work clinical shifts, and we were talking about, because hospital, everybody's wearing a mask regardless of vaccination status, and many of us were saying, why don't we do this forever? It kind of protects everybody in respiratory virus season. So it may be that we've seen some of these requirements for distancing and masks gradually slow down. They may ramp up and ramp down over time, and I think we're going to see other countries use masks pretty routinely and have for years after certain outbreaks, and just kept that behavior. We may see some of that here. The requirements are really going to depend on the public health data and politics, frankly, but the public health data. So it may be that it goes away a bit for the summer and then starts to come back as the winter comes. Who knows? Carissa?
How many more cases are we now seeing of COVID versus what we see with the usual annual flu season?
Yes, just saw Dr. Parrish pop on. Maybe she'll pop back on. That's an interesting epidemiologic question.
Yeah, so I think this question might kind of speak to, kind of what is what can we have accept, as a baseline of number of COVID cases, and it's a little bit hard to compare. Obviously, different flu seasons are different. The last flu season was almost non-existent, primarily likely because of all the mitigation measures that we've been doing. But otherwise, there are several million cases of flu each year, or flu-like illness, and many of those hospitalized, and usually several thousand flu deaths each year. So, again, I think the underlying question comes down to, um, kind of what is the acceptable kind of COVID rate, where we can, treat it like flu or like any other thing. And that kind of ties in with the previous question, I think, which was a question that kind of asked about getting back to normal. So for COVID, I think, we need to keep in mind that as long as COVID is spreading anywhere in the world, it is always a risk to us in the U.S. Obviously, we're not an island, and there's travel, and we know these variants spread, quickly. So as Till mentioned, we may be um, permanently changed in terms of kind of the way that we look at infectious disease, and the way that the way that we act in terms of the prevention measures that we do. Um, so, kind of to get back to your question, I think that COVID will be with us for a while. We I think in previous town halls we talked about herd immunity, and we haven't talked about that recently because that seems so far off for us, and we really haven't reached anywhere near kind of the original thresholds that we feel we need to reach for that. And then, of course, again, with the disparity in vaccination around the world, where some countries haven't really even vaccinated many of their healthcare workers, and the global burden of this disease, we're COVID is going to be with us for a while. So with that, I think that the way that we navigate this going forward is that we can expect um, things to go back to the way they were, and I think that a lot of people kind of have to kind of come to terms with that. And as Till said, it's hard to predict, and none of us have a crystal ball. But the way things have been going and are going, there's still a lot of measures that we need to keep in place.
Hey, Krista?
Next question. Will booster shots be needed, and if so, when?
I'll take that one. I think it is still likely that booster shots are going to be needed. The companies and scientists are clearly developing data on whether and how fast immunity wanes from an antibody standpoint. Part of the question is the antibody response, and part of the question is kind of the real world response of vaccinated persons, and whether they start to have increasing rates of infection. I think the general consensus is that booster shots are likely. If it's like other diseases, it may be 12 to 18 months. We're not sure. And in fact, the booster shots may be somewhat changed. One of the advantages of the NRA, particularly the mRNA technology, but others, is that one can adjust the shots to more accurately reflect the variants that are out in the population. So this is going to be another communications challenge, and another public health challenge to get folks boosters when they need them. Carissa?
Any information on longer term experience or symptoms that people are experiencing?
Yeah, this is a major issue throughout the healthcare system. I'll answer, and then Dr. Parrish may want to weigh in a little bit also. Throughout the healthcare system, we're seeing long-term neurologic and other effects that people are suffering for, and respiratory effects and other things for weeks to months after COVID, that are pretty severe, and they require an interesting multidisciplinary response. It's not like there's a specialty of medicine that is the landing spot for people with long-term COVID symptoms. So It's requiring multidisciplinary response. It's not like there's a test that one can do and say, you've got grade 2 or grade 3 case of long COVID. But it clearly is a significant part of the population, and we're seeing it in both the younger population and the older population. Dr. Parrish, do you have anything to add to that?
No, I don't have anything else to add. You summarized it perfectly.
Thank you. Carissa?
Why are the vaccination rates so low in places like India and Australia?
There are a lot of reasons. It's sort of a combination of supply and logistics, as with many things. Many countries, if they're not, and India actually has some capacity for manufacture. Australia not as much, but many countries were not out ahead of in the purchasing and arrangement for vaccine supply. The U.S. was pretty far ahead, as were some other countries. And then the logistics chains are difficult in some of those settings. So everyone has its own issues, but we're seeing very low, in Japan, which doesn't have much manufacturing capacity for this kind of thing, and didn't really plan ahead. I think a lot of this is going to be inherent in some of the after action reports. In some cases are easy, where there are very poor countries in parts of the world that just do not have the infrastructure, the resources to do it. Other countries with somewhat more resources, India, Australia, perhaps were a little resource constrained or didn't plan ahead or something.
Okay. Have you seen cross-sectional data on the percentage of people with natural immunity from prior infection and its contribution to herd immunity? What are your thoughts?
I'll turn that to Dr. Parrish.
Yeah, so what we know for COVID-19 is that natural immunity tends to wane, and it's not as durable as immunity provided by vaccination. So in the short term, that natural immunity from infection does contribute to, I guess, to a level of herd immunity, and you can see that. Right after the surges, for example, the last big surge in December when so many people were infected, and not many people were vaccinated at that time. But you saw that after that, cases, starting in January, probably mid-January, cases were coming down pretty precipitously. And part of that was because, so many people were infected or had been infected and had that post-infection immunity that that there weren't as many susceptible people to get infected. And then, of course, other folk, and in addition, you had the mitigation measures where people were scared straight and actually used the mitigation measures. So we could see in the epidemic curves, how that helps. However, again, we know that people get reinfected with COVID, and especially if they're exposed to variants. So vaccination is really the only way we can reach herd immunity.
Next question on that note, do you feel we'll ever truly reach herd immunity with vaccinations being optional?
That's so hard to say. And so there's so many variables with herd immunity, and even the kind of percentage vaccinated that is given are estimates. And for a pandemic disease, and especially as as we were alluding to and discussing, with so much of the world not having access to vaccines right now, it's going to be very difficult. I think that the more people that are vaccinated, the better, even if it doesn't reach the formal level of herd immunity, then it will still drive down transmission rates. It'll still drive down those rates of COVID, and make it safer for people in the community. Formal herd immunity indicates that transmission is basically interrupted, that the virus can't spread in the community because so many people are vaccinated. We might not get exactly to that stage, but we can get close. And the more people that are vaccinated, the better it will be. And we're already seeing that in the U.S. with our increasing rates of vaccination, helping to drive case rates down.
Thank you. Actually, that is all the questions that we have. Dr. Jolly, do you have any last statements here?
Yeah, thanks. Lots of questions, and thanks. We actually see an answer from one of our experts at BARDA about booster shots not being needed for the fall, but waiting for data at the 12-month mark. Thank you for that. We clearly have, not just those of us who spoke, but clearly have lots of expertise within Aveshka on lots of these areas. So certainly, if you've got something that is important to our planning internally for our workforce or for our clients, please share that, because there's clearly a lot of scientific and operational expertise among this group. So, as we said, first I want to thank Greg and Deidre for speaking today. Lots of important input, and Aaron for important input about our employee base and keeping everybody safe and figuring out how to operate in a new environment. This is still, an ongoing pandemic. We're clearly going in the right direction in a number of ways, but have some challenges. I want to emphasize again, keep yourself safe and keep yourself whole, and manage your mental health and the mental health of your family. We've been through a stressful time, individually and as a nation, and need to keep working hard at it and helping each other. So we're going to continue to do these and provide you information when it becomes available, and look at issues as they change. Thanks again for your participation. I'll turn it back to Girish for any final statement.
And let me second what you said, Till. Thanks to all of the presenters. This is truly invaluable information that we, the employees of Aveshka, have the opportunity to get. It's very difficult to get this level of insight and information, frankly, in this day and age. So it's truly appreciated. I also want to congratulate the employees that were recognized by Aaron for this quarter. Appreciate all your hard work and your outstanding efforts and contributions to the company. Finally, I'd like to thank Carissa for doing an outstanding job in moderating this presentation with the questions and so forth. Again, I just want to wish everybody stay safe, stay healthy. I know it's been challenging. We're making the turn. Hopefully, good things are ahead, but frankly, at this stage, it's more important for us to be judicious and cautious and stay healthy and stay safe.